Kala Azar. Kala Azar may not sound familiar to most of us, but for the underprivileged and downtrodden, it is a dreadful experience, which is considered even worse than death. Despite being the second deadliest parasitic killer, it is often neglected due to its reputation of being a poor man's disease. The neglect associated with it manifests injustice, inequality and deprivation to the extent that it becomes an affront to human dignity. Kala Azar is a vector-borne disease which spreads through sandflies, commonly found in humid regions. These flies breed in cracks found in mud houses in dark and humid conditions. Common symptoms of Kala Azar include fever, weight loss, weakness and an enlarged spleen. Currently, the disease is limited to a few districts of India apart from East African countries, Somalia, Brazil and Iraq among others. Dumka district is one of the only two Kala Azar endemic districts in the country, and despite efforts spreading across several years and regimes, the endemicity could not be eliminated. Taking a cue from Hamlet that diseases desperately grown are cured by desperate measures or not at all. The Dumka district administration has taken up the challenge to eliminate Kala Azar in full throttle, involving multiple stakeholders at all levels of administration. The district administration has employed an intensive program of indoor residual spray or IRS for every household. The IRS is preceded by an extensive information, education and communication program that is aimed at creating awareness as well as disseminating prevention methods. For identification of suspect cases, active case search is done 6 times every year. ACS involves dedicated teams of health workers like ANMs, ASHAs as well as field level workers like Anganwadi staff and members of self-help groups in convergence and saturation mode. Dumka administration regularly conducts in-depth training sessions for all field level workers on prevention and detection of Kala Azar, along with several IEC activities. All individuals found infected are given full treatment at the community health centers nearby, while complicated, severe and relapse cases are treated at the specially equipped Fulo Jhano Medical College and Hospital in the district. Through a multi-pronged approach, we have been able to reduce the occurrence of Kala Azar by more than 67% in the past few years. The district administration is also addressing multi-dimensional poverty-related issues in these communities by building pakka houses, toilets, soak pits and cattle sheds. Water testing through field testing kits is regularly done in affected areas. For real-time reporting and follow-up, Dumka administration uses ICT tools like Kamis and http://sarvodaydumka.in/. It further runs a dedicated Kala Azar helpline which helps in identification, treatment as well as prevention of the disease. Dumka is well on the course to eliminate the Kala Azar endemicity. As the people of Dumka say, Asud Babun Tahina. So we resolve that we will no longer be sick.